the first question was, in the Netherlands, what is the air velocity control? The supply of fresh air to manage IAQ or recirculated? And if recirculated, was expected benefits? So please answer so everybody can hear the answer.
Yes, thank you, Bjarne. The air velocity was only increased air velocity of recirculated air, so there was no additional fresh air supply. So the potential benefits was really for the summer or when the buildings start overheating to have some cooling effect of a higher air speed.
So I think the next question is also for you, and that is about the localized heating.
Yes, I think that's the good question. I already read that one. Indeed, the most effective way to prevent thermal discomfort if it's getting colder would be to focus on the extremities of the body, so the hands and the feet. In this case, we focus on the underarms and hands. But I can definitely imagine that a useful addition to this solution would be to also have an additional heating device focusing on the legs or even the feet. And it was already also investigated by Wei Lu. He did a study in the lab with using the same desks, but also provided the participants with a heated mat on the floor. But I don't know by heart whether the participants wear shoes or not, because that is the other thing. You wear shoes if you really want to be effective, then you can discuss whether it would be effective to focus on the feet or maybe on the legs, because if you have a high insulation value of the soles of your shoes, it may not be that effective.
Will there be any potential for utilizing PECS in hospitals and clinics for patient comfort? Maybe PECS about patient beds. It's a pity Arsen is not here, because Arsen, he had done a lot of studies with localized exhaust and change of airflow from the patients to protect the nurses and doctors. So there is studies on that. I don't know, Chandra, if some additional to say regarding that.
Yeah, sure. Thanks, Bjarne. I mean, I was just going to say that the study that we were doing in our environmental chamber was more in the context of a doctor sitting in the consultation room over a period of 2-3 hours, and then you have different patients who walk in and out, and at that time they are not yet screened for how sick they are in terms of any potentially infectious viruses, infectious aerosols. So the idea of, once they enter the consultation room and sit in a chair that has the capability of a local extraction built into the chair, and then the doctor moves to the chair with the patient being there, or the patient moves around on the chair. The idea was to somehow contain any exhaled aerosols by the patient within that space of the patient, and then to extract it locally. That was the idea in which we did that. So obviously, but Bjarne, you're right. Arsen has done quite a bit of studies with the patient lying on the bed and different positions of the healthcare professionals. We didn't quite do that, but then the logic is quite there. If there can be a local either supply to the healthcare professional in such a setting, or extraction from the patient bed, that would definitely be quite beneficial.
And then we have the $1 million question. So, and that's really for all the speakers. How, so I'll ask you to give a couple of comments on that, how you assess the market maturity of the respective PECS. What are barriers for deployment? What is the technology readiness level?
You want me to take a cut?
Start? Yes, do that.
Shinichi is raising his hand. Go ahead.
For the first question for the hospital, we did really implemented for dialysis room because the patient don't like air movement very much. So we installed a radiant cooling and heating system for the patient because the draft risk is much higher for the patient with the dialysis. And then it's a medical doctor, the nurse. So they're moving a higher metabolic rate. So they need the air movements. So that's why between the bed and some corridor, we installed the air movement device for them. So it's very high satisfaction for the medical doctor, nurse, and also for the patient. This is maybe one solution that PECS is only increased the air movement, but it's a good application example.
Now you have the mic, Shinichi. What about the second question there about maturity, access market? What are the barriers?
Oh, yes, it's a very good question. Most of the PECS system installed in Japanese building is their own building. You know, owner of building is much more easy to install. But a PECS system is belong to the HVA system or furnitures. So accounting system is different when you buy the furniture. So use this kind of money. But if you install HVA system, it means you need the building account money. So that's when they always have a trouble in the what they call tenant type of the office. So PECS belong to the building or PECS is as a furniture. So accounting is different. So who pay? So that is a critical point I feel in Japan. So owner building is much easier to install.
Okay.
So maybe
Sandra?
I can add to that, Bjarne. I fully agree with Shinichi. Our experience in Singapore, we don't have too many installations anyway. The one I shared about the work we did 10 years ago, that was also in an owner-occupied building, actually. It's BCA Academy. And the one I showed towards the end where we had the spot cooling devices integrated in the partition of the workstation, that's also in an owner-occupied building, the same BCA, trying to demonstrate new technologies being deployed in buildings. I guess the biggest challenge is exactly what Shinichi said. One is part of a building infrastructure. The other one, when it comes to PECS, we are now dealing very closely with what one would call as tenant involved aspects, furnitures, layouts. These are all very dynamic. When you have a change of tenants, you probably are going to look at different layout configuration. But this is my thinking, and maybe eventually we might head that way. What would stop anyone from thinking along the lines of, let's say we have the outside air, the ventilation provision or the fresh air provision as an infrastructure plug and play concept at the building infrastructure level. And I think PECS will really be very positively influenced if the furniture designers can really take a more closer look at that. So I'm thinking in terms of different types of furnitures available for office configurations or other configurations. As long as there is a way to connect that furniture to an air distribution supply, you're good to go. So integrating with HVAC designers, consultants and so on, to plug in with a furniture that is PECS ready. It has all the end ATDs, the desktop, desk mounted, partition integrated. You still need the air to reach that place somehow. So I'm thinking in my mind, plug and play, maybe there is some excitement there, but we are far from there in my view. We don't have those kind of thought processes in place. At the moment, it's still owners who are interested, who believe it's helpful, are willing to try something new, but the norm is not quite the norm yet. And I think Bjarne and the others, we are all here in this annex to try and take that extra leap forward in terms of the PECS application in the industry. So hopefully we have something positive heading in that direction.
You're from Netherlands side. You add something you have to add?
Well, maybe I totally agree with this really important barrier, but therefore I can also imagine that it would be wise to now focus on these building owners and the people who are using that. So with these guidelines to help them to apply it, because they also have the benefits of using these PECS. And then if we have in a few years, we have some really good practices, they can also convince that when there is a building owner and a tenant, that this could be a good solution working. And then I think it would be really helpful to have more examples of these solutions in practice. So I think we should focus on that, make these solutions possible, so we then can help this innovation further. And on the technical part, I think we have enough to use.
Yeah, I myself have the idea that there should be a market in residential homes. We see more people, they work at home, maybe at least 2 days a week. We have a discussion who is responsible for the working environment from home. So if the companies could provide you with a personalized system, they would have taken care of their responsibility to give a good working environment. So I think in the future, there could be a market also if you were a producer. We had one more question.
Yes. In reality, we use a lot of heat pump in the building. So this building is very challenging building. So and also we have some heat to do fumigated system, DOS system for the after the water. So I agree with you, but it's a heat pump system in Japan. It's quite a lot to use in Japan. So this is one of the challenge. Yeah, I agree with this comment. Thank you.
If I may just, can I just say one more thing here regarding the barrier? I think one of the challenges that we have heard from consultants, practicing engineers is, okay, PECS sounds interesting. The research is very positive, but how do we design it? So I think there is this lack of a design tool or design guidance, if you like, especially if you want to integrate that with a background system. I think we could do some advancement in that area. Most of conventional HVAC designs, you always have design practice, design tools. When it comes to PECS, it's not quite there. I mean, of course, one can get down to first principles and start doing it that way. But I think it will be good to have some sort of a design guide handbook. And I am aware there has been an interest in developing something like that. Hopefully, this annex will also point to us some of the needed features that we need to put in there for design guide or design tool.
From very loose paper, they're asking was performance, was that celebrated or was it measured?
Yes, question and short answer. They used cognitive tasks, so objective performance measures to measure these effects.
Okay.